I'm Dr. Shawn Tassone. Welcome to Confessions of a Male Gynecologist, a podcast dedicated to women's health and hormones, and pretty much everything else you were never listened to when you went to the doctor's office. I'm board certified in OBGYN and integrative medicine, and I have a PhD in mind-body medicine. I guess you could say I'm a little bit outside of the box. In this podcast, I'm going to get you the answers you probably asked 5 other doctors and were kind of blown off. I want you to know that I'm not only here to talk, I'm here to listen as well. And now, let's get to those confessions. Hey everybody, welcome back to another episode of Confessions of a Male Gynecologist. I'm your host extraordinaire, Dr. Shawn Anthony Tassone, author of the Hormone Balance Bible that you can get on Amazon, published by Harper Day Street. Goes through the 12 most common hormone imbalances in women. Also has a 6-step process that I have coined the Shines Protocol, which is a spiritual practice, hormones, infoceuticals, nutrition, exercise, and supplements. That's a 6-step process you can use to fix your hormones and balance your hormones naturally or with the use of hormones, however you want to do it. You can get that on Amazon. I also see patients across the country. I have licenses in 46 states. I can see you via telemedicine. I don't take insurance because I wouldn't be able to run my business if I did, but I'm happy to see you. I'll order labs, get you started on any hormone regimens. And then after that, you only have to see me every 6 months. So I can help you. I've got 800 5-star reviews on Google. I've really dedicated the last 15 years of my practice to hormone replacement. I've written a few books on hormones, so I get a lot of women that come to see me that have seen 5 or 6 other doctors and can't get help. So what I wanted to talk about today, because this space is so confusing because obviously everybody's an expert. But what I wanted to talk about today was the way that you can use hormones, because this, for a lot of women, 1, they don't know the options, or 2, they have been told things that aren't necessarily true about certain options. So I wanted to give you the options for hormone replacement: pellets, patches, pills, injections, creams, all this stuff, and just go through those, give you the pros and cons of each. And then you kind of, when you meet with your physician eventually, you kind of can decide what one sounds right for you and what's the best option for you. So how do you know which one's the right choice for you? Well, the thing is that it's very confusing, and hormone replacement, in my opinion, is not a one size fits all. Different methods have different risks. With different types of hormones. There are women out there that are being overdosed all the time. They don't know what to take. And basically, I just wanted you all to have the different options and know that there isn't a right or wrong way to do this. The best way to do hormone replacement is the method that is easiest for you, that is the lowest cost for you, that also makes you feel the best that you can. The individual factors that go into this are, your age, your lifestyle, your preference, your risk factors, meaning your medical history. Do you have a history of blood clots? Do you have a history of cancer? What's your metabolism? What's your weight? And things like that. So really, there isn't, as I've said, a one size fits all. It's really dependent upon you as the individual and what it is you want to achieve. Again, I've mentioned this many times on my Instagram page. You can follow me at Shawn Tassone MD. I talk about how this concept of optimal levels, you'll hear these health coaches and functional practitioners talk about optimal. And optimal, in my opinion, especially for hormones, is a myth. It's made up. And it's made up because some of these folks want you to believe that they have learned something that nobody else knows. Optimal to me is where you feel the best, where you have a level that's in the normal range, but you feel good there. And for some people, that might be at the 25th percentile of normal. For some people, it might be at the 75th percentile of normal. So there isn't just an optimal that you shoot for because you're different than the person next door to you or your sister or your mother. So I want people to get away from this concept of optimal ranges. The only hormone really that I do have a number that I shoot for in women is with estradiol, because estradiol, we have some research that shows that if you can get that number above 60, and probably between 60 and 150, because we don't want to go too high, that's the level that protects your bones. And that's something that I think is obviously very important. But that's really the only one that we have research on to show that at a certain level, you get benefit. So that's what I shoot for with estradiol. So let's talk about the different methods and why I dislike or like certain methods. And the first one and the easiest one for me to talk about are pellets. Hormone pellets have been around for a long time. They have been used in animals, which I think is where they started. And this goes for women. I don't usually go into the male aspects, but for men, if they have a high testosterone level, they might just be bigger jerks. But it could be harmful. But I don't go into males, so these are specifically geared. My talks are always geared more towards women. So why do I hate pellets? Why do I think pellets are malpractice? Why do I think that the companies that make the pellets are unethical? And again, my opinion, but why I think that the doctors that are putting them in are putting profits over patients. First of all, the people that put in pellets go to a course. So they go to this course that's obviously put on by the manufacturer of the pellets. The two big companies I can think of off the top of my head are BioT and Efficacy. And I've seen their trainings. I see them online all the time. And I know practitioners that have used these pellet training companies, and they are specifically told that you want to get your levels above like 150 to 250. Now, keep in mind, a total testosterone in a woman, the normal range is 2 to 64. These companies are telling practitioners to shoot for a level that's 3 times the normal rate. Now, this is what I've heard. It's hearsay, but this is what I've heard from, and you can see it online all the time. They talk about it all the time. I've had physicians who are not, in my opinion, hormone experts, like anesthesiologists that go to these courses and they learn this total garbage. And I've talked about this on some of my other podcasts, but there's lies that you're told from these companies that are told to the practitioners. One of these lies is that, oh, it gives you a steady state. This is completely false. These companies have absolutely no research to pretty much back up anything that they say. They tell the practitioners that the levels are steady. There's nothing magic in these pellets that keeps those levels at a steady state. And as a matter of fact, what they do, and I see this all the time because I've seen thousands of women that have been on pellets, you'll get the pellet put in and it releases at a high rate in the very beginning. So your testosterone goes through the roof, and they purposely don't test you a month or two after the pellet insertion because you would probably freak out because your levels would be super, super high, probably 4 or 5 times the normal range for a woman. And then they decrease over 3 to 6 months. So you get this sawtooth pattern over time. And when you have that peak, that super high level, what happens is, let's say your level is 350, and then you start to drop. Well, let's say you drop to 150, which is a huge drop. I mean, you're dropping now by 60%. You're still 2 times the normal limit for a woman. But because you've dropped so much, you start to have withdrawal symptoms, fatigue. You might not feel the same way you did. You might not feel like Superwoman. And that creates a withdrawal symptom. So you feel like, oh, I got to go get my pellets again. So what do? They just dose you again, and then you're back with the same pattern. So that's one reason I don't like them. You're overdosed and you keep getting these things put in. It's a surgical procedure. I'm sorry, but it is. You go to the office, they have to clean and prep the area. They then have to cut your skin with a knife. They have to dig a pocket with this big ass trocar and they shove it in and then they put the pellets in. I've seen women have infections. I've seen them have horrible bruising. I've seen them have bleeding. I've seen them actually have issues where they spit the pellets out, like the pellets will come back out through the incision. And you think about it, you have to do this surgical procedure every 3 to 6 months. Another reason I don't like them is because of the costs. If you looked at the cost of pellet insertion and you break it down into a monthly fee, you're looking at probably around $120 to $150 a month when you could get a cream or a sublingual tablet for $45 a month. So it's about 3 times the cost. It provides absolutely no benefit over any other method. It's an overdose. It's a surgical procedure. It's more costly and it provides you absolutely no benefit. And in my opinion, it absolutely harms you. When your testosterone levels are too high over an extended period of time, which is what happens with pellets, you can have voice deepening, your clitoris can enlarge, and those are 2 permanent things. They usually don't reverse. Your cholesterol will go out of whack. Your bad cholesterol will go down. Your high cholesterol, your bad cholesterol will go up, and your total cholesterol will go up, which can increase your rates of heart disease. High testosterone can add to high blood pressure, and these are silent things. So people always tell me, "Oh, I love my pellets. I feel so good on them." Well, you feel good taking cocaine too, but you're not out there snorting every 5 minutes. Just because you feel a certain way doesn't mean that on the inside your body's not dealing with some things that over time can cause you serious harm. And so personally, I think pellets are disgusting. In my opinion, there are absolutely no pros. There's no good things with pellets except for maybe they last for 3 to 6 months. But other than that, there's absolutely nothing that they benefit. And in my opinion, this is my opinion, the people that are putting them in are doing it because they make a lot of money. So I did a study in my own practice where I looked at all of the hormones that I do here in Austin because you'd have to be local. And I would make about an extra $25,000 a month just putting in pellets. So the doctors that are putting them in, they're not putting them in because they benefit them, they benefit you. They put it in because it benefits them. They wouldn't be doing it if they weren't making money. And now you're seeing them at med spas. Plastic surgeons are putting them in. Anesthesiologists are putting them in. People that have absolutely no concept of what hormones do, they go to these courses and they teach them what they want them to know. So you don't have a hormone expert managing you. As a matter of fact, anybody that's a hormone expert won't put pellets in because I know a lot of them. It's all about money. It's definitely all about money. And these wellness clinics, these med spas, I would never go to one of those places for hormonal management. Anyways, that's just me. Another method that you can use, patches. Now, keep in mind, patches, most of the patches that are on the market that are estradiol are bioidentical. The patches that are on the market come in multiple doses. They are usually twice a week, but there is one available that's once a week. Now, you will get a similar process where your estrogen levels will probably be higher for the first 2 or 3 days that you put the patch on, and then maybe towards the end, you start having symptoms again. Because again, it's not a scientific steady state release. And most women might complain around day 4 that they start having symptoms again. Not the end of the world, but it could definitely happen. There is a patch available called Combi Patch that is an estradiol patch with a progestin. I don't use Combi Patch because I don't like progestins. They're fake progesterone. They're synthetic, and you don't get the benefits that you get from a bioidentical progesterone. Now, the progestin that's in a Combi Patch will definitely protect the lining of your uterus so you wouldn't get uterine cancer, but you're not going to get the benefits of sleep, anti-anxiety, or just that decreased feeling of edginess. You won't get any of that from a progestin, and you would get that from an actual progesterone. So I tend to use, if I use a patch, I'll use bioidentical progesterone that you would take at bedtime. But patches do have a little bit more of a consistent absorption. Because you're using them topically, they'll bypass the liver. So with oral estrogens, we worry about the process through the liver just because some women may have elevated liver enzymes because they have fatty liver disease, and we want to take the stress off of the liver. There's also no increase in risk of blood clots. So certain women who had an issue with, say, a birth control pill, which is, again, a synthetic estradiol and a synthetic progesterone, shouldn't probably take a birth control pill because of the increased risk of blood clots. But if you're using a topical estradiol as HRT, totally different beast, totally different medication, does not increase your risk of blood clots. Now, the risks with oral estradiol, if you were to take HRT as a hormone replacement and you had to use oral, the increased risk is only 1 in 1,500. So it's not a dramatic risk. But if you wanted to eliminate that risk altogether, you could use a topical estradiol, and patches would definitely do that. They also come in 5 different dosages. So you can start really low. You can go up as you need to. I have some patients that, for whatever reason, I have them on low doses. Maybe they have a history of breast cancer and they're suffering and they just want to get rid of the hot flashes. And we've tried other things like Vioza or maca or some other plant-based supplement, and it's just not working and they're miserable. And I might put them on a 0.025 milligram patch, which is the lowest dose possible, and see if that works. So patches are easy to adjust. You can cut them in half. You can do all kinds of things with them. The only downside to patches, I do have the occasional woman that will have a side effect with the adhesive, like the tape. They'll get a rash or they'll get irritated, and they just want to get off of them because they just don't like having to do that. Another thing is anything you do, like if you're one of those women that likes to do a hot sauna, if you're constantly going into the sauna, because you're heating up that patch for like 40 minutes, it could release all of its medicine at once. It could release more, and then you run out around day 3. So it's not like particularly dangerous, but you might be affecting the way that the patch releases the estrogen. So if you're somebody that likes to sauna a lot, I probably wouldn't use a patch. And then the other downside is sometimes they fall off. Occasionally I've had women where it just won't stick. And then I've had the other problem where it sticks too good and they can't get it off, or they hate peeling it off because it hurts. And over 3 or 4 days, it can get a little dirty and dingy looking, and some people don't like that. It's great for women that have cardiovascular risks or clotting concerns, or women that don't want to do a daily dose. So it definitely has benefits. It has minimal risk, and it's a great way to replace estrogen. The other benefit to a topical patch is that it's made by big pharmacies, so therefore it's in your commercial pharmacies like Walgreens, Walmart, and CVS. So it's not compounded. It doesn't have to be made. It's already available. So patches are great. I use patches all the time. Not something that I'm afraid of, and I think patches are probably underutilized. Another option is a pill. You can, as I said already, progesterone is widely available commercially, CVS, Walgreens, as a bioidentical pill. So I use oral progesterone 95% of the time if I'm using a progesterone. Estradiol as a pill is commercially available, but only in 2 doses, 1 milligram and 2 milligrams. So some women might need more, some might need less. And so it doesn't give us the flexibility with the dosing. The other thing is that an oral estradiol will go through the liver. It gets processed through the liver, as will progesterone. And oral estradiol can increase your risks of blood clots. There is a small risk of breast cancer because oral estradiol has more of a propensity to break down into something called 4-methoxyestrone. As your body's trying to eliminate the estrogen from your system, it can turn into 4-methoxy, 2-methoxy, or 16-methoxyestrone. 2-methoxyestrone is actually cancer protective. 4-methoxyestrone is labeled as a carcinogen. Women that take oral estradiols have more of a propensity to break down the estradiol into 4-methoxyestrone. So that's just another reason why I try not to use it. Now, I do have some women that use an oral pill because they want to. It's covered by insurance. They didn't like the patch for whatever reason, and they don't absorb creams, which I'll talk about in a minute. It's a convenient format. I mean, most people can swallow a pill. It is easy to adjust. We can, change the dose, but there's only 2 doses. Now, I can compound an oral estradiol. I can make 0.5, 1.5, whatever, but it still would have the same risk. So it's the same estradiol if it's through CVS or Walgreens. And it's the same if it's compounded. It's just compounded at a compounding pharmacy. The estradiol also that's available called Premarin. I don't use Premarin. Premarin is a conjugated equine estrogen. And the equine part means that it comes from horses. If you've ever wondered, and if you're one of those people that likes history, most pharmaceutical drugs will go generic after they've been around for 6 or 8 years because the trademarks go away and so they can duplicate it. In order to duplicate a drug, you have to know exactly what's in it so you can duplicate it. Premarin has so many things in it, I think 18 to 27 different items, and some of them they can't even label. So nobody's been able to go generic with Premarin because they don't even know what's in it or some of it. So I went away from Premarin, although I will say in its defense, the Women's Health Initiative, which was that horrible study that scared everybody, the Women's Health Initiative did show that there were 2 arms in that study. There was a Premarin only arm, meaning the estradiol only or the estrogen only arm, and there was a Premarin Provera, which is medroxyprogesterone with Premarin, which is a horrible combination. The Premarin only arm, the one that only had estrogen in it, they actually did not have an increased risk of breast cancer and actually had a 50% decrease in colon cancer rates. So not necessarily a horrible medication, but it was the combination of Premarin and Provera that had the increased risk of cancer. And even then it was 1 in 1,000. What's funny about the study is that we already knew that. It was in the package insert, but nobody bothers to read that. Again, the downside to oral estradiol, first pass through the liver, and just something that I tend not to use. Now, that's estrogen and progesterone. Testosterone, you can use as a pill as well. And I have a few women that take testosterone capsules. Now, I usually will try creams first or sublingual tablets. And I'll talk about sublingual tablets here in a second. Testosterone is absorbed different than estradiol. It's usually a lymphatically absorbed medication, so it doesn't necessarily go through the liver. As a matter of fact, there's a testosterone undecanoate that's coming out for men, obviously, that has absolutely no liver metabolism. So oral testosterone can be used, and it can be used safely. Another form of oral medication, it's oral because it's a sublingual tablet. It's called a troche or a rapid dissolve tablet. Now, it absorbs directly into the bloodstream because you look at all the blood vessels under your tongue. It is absorbed directly, so it does bypass the liver. Now, you're going to swallow some of it, obviously, but it's usually probably in the neighborhood of 10 or 20%. There are no studies on troches because there's no money to be made because they're not made by a big pharmaceutical company, but they can be compounded. I have been doing this for 20 years. I get levels all the time. With a troche, it's a little trickier because it absorbs all at once. So if you draw your blood an hour after you use your troche, it's going to look like your levels are through the roof. So it does give you that peak and then dip throughout the day. So for some women, if they're on this sublingual tablet, I will have them cut it in half and do half in the morning and half in the afternoon. And then I always draw blood in the afternoon because I want to see what your levels look like towards the end of the day versus right after you take it. And again, none of these are good or bad. There's just different options. Lastly, I wanted to talk about creams. These are compounded. There are some estradiol creams available on the market. There's also Evamist, which is a spray that goes on the arm, but these are estrogen only, and they're widely available and they're great. But the reason that I like compounded creams is because you can put anything you want in them. The dosing, I can put estrogen with testosterone with DHEA. You can really alter it however you want it. The downside to a cream is that some women just won't absorb it. Like maybe 5 to 8% of my patients, I'll start them on a cream, their levels don't change at all. So and they don't feel any different. So I'll move them to a sublingual or a patch or something like that. But some women, I just can't get them to absorb it. You get the same benefits as a patch. It's a topical, so it bypasses the liver and things like that. Occasionally, I'll have a woman, if I combine things, that will absorb one of the hormones and not the other. So then I'll split them up. But cost wise, if you put 3 hormones into that cream, it's the same as if you put one. So the price doesn't change. It's usually around $50 a month. And for some women, it's almost as expensive as just doing bioidentical progesterone pill with a patch because your copays are $25 each. So I just wanted to go through these because I wanted you to know that you have options available to you. The question then I get is, well, I give women those options all the time. What do I choose? And like I said, there's no right or wrong way to do this. It's just how you want to do it. So obviously, if you had a blood clot risk or something like that, I would definitely probably urge you to start with a cream. But it's lifestyle. It's, how active are you? Are you doing saunas a lot? Are you swimming a lot? When should you put it on? Things like that. Access and cost as well. Some people don't have immediate access to a compounding pharmacy where they can have a cream made, so they'd rather use CVS. So it's really just up to the person. It's all about personalization for me. What's right for you may not be right for your neighbor, and just so that you have choices. Just like I've talked about a million times, where the same with lab testing, the same with what doctor you see. People will always ask me, well, how do I get my doctor to do labs? They don't want to do that. Well, you're not going to change a doctor's mind on anything. They have their practice patterns. They've learned these patterns over time. And if they don't want to do something, they're not going to do it. And it's not your job to change their mind. Your job is to find somebody that's going to help you. And there's plenty of people out there now that are helping, myself included, giving you all these options. So to recap, no single delivery method is best. It's about finding out what works for you. And because women get so much misinformation out there nowadays, I'm hopeful that you'll share this episode with your female friends, because I want them to know that there's options available. And the way that we change the medical system is by pushing what works, because what happens is doctors won't necessarily change their minds if one person comes in. But if a lot of women come in and say, you wouldn't test my lab, so I had an online doctor do it. And they might start looking into things because they don't want to lose patients. So if they keep hearing over and over again that labs are being tested, they may start learning. So follow me on Instagram at Shawn Tassone MD. I'm also on Substack, Facebook, and TikTok. You can follow me there. I talk about these things all the time in little snippets that are easy to consume. You can follow me on YouTube, where I do more longer format stuff. If you are struggling, if you can't get somebody to help you where you live, if you are not getting labs tested, if you're on hormones and you're not happy, if you can't even get hormones, feel free to give me a call at my office. I'm here in Austin. Like I said, I'm licensed in 46 states, so I can see people across the country via telemedicine. I order labs where you live. I can prescribe, and have things shipped to you if you can't get a compounded one. You have options available to you. And that's the ultimate message here. And I talk about this all the time, but it's really what's important to you, what you need, what you want. And because we're all different, you may need something different. And I know there's doctors out there saying that that's just bogus. These 2 doses have been tested and will work for most women, but they say most. And so you have options available to you. So again, follow me, get as much information as you can, be an informed consumer, and I will catch you next week. Take care. Thanks for listening. If you enjoyed this episode and you'd like to help support the podcast, please share it with others, post about it on social media, or leave a rating and review. To catch all the latest from me, you can follow me on Instagram at Shawn Tassone MD, or on Twitter at TassoneDoc, and on Facebook at America's Holistic Gynecologist. If you're really interested in your hormones and you want to do a deep dive, get my book, The Hormone Balance Bible, on Amazon or other major retailers. Thanks, and I'll see you next time.